Chemotherapy. The word evokes fear, images that are negative, harsh, scary. One forgets that in the tough fight against cancer, chemotherapy is an important weapon, a weapon that kills the enemy, and the enemy is cancer. Chemotherapy is the use of drugs or medicine to destroy or slow down cancer cells. Given by saline or in the form of pills, the chemotherapy treatment is tailor-made for each patient. Maybe a single medicine or a combination, depending on the need of the case.
Chemotherapy is to take care of any cells which have escaped or have lodged elsewhere in the body, maybe in the bone marrow, it could be in the lung, anywhere, or any cells which are in the circulation. Chemotherapy would take care of it.
Chemo enters the circulatory system to hunt out the rapidly dividing cancer cells, attack them. Like an army, it's wartime. Seek the enemy, stop it from growing, kill it, wherever it is in the body. And like in any battle, there are losses. Chemotherapy works by attacking rapidly dividing cells. Like cancer cells, there are other normal cells in the body that grow fast. Blood, cells in the intestines and mouth, nails and hair. So the side effects are diarrhea and vomitings. The patient may feel fatigue, loss of hair, the most visible side effect of chemo. The body's ability to fight disease may go down. Nail color or texture may change. The mouth or throat may develop sores or blisters. The patient may lose or gain weight, or may even feel a change in the sense of smell or taste. The side effects are temporary.
And there are side effects, but again it is unique to each person. Suppose if you had vomiting, that does not mean I'll also have vomiting. And each person has their own way of fighting it. Each person has their own immunity level. So how you keep yourself during that time, how is your environment? There are some common things which will happen, like hair loss होगा, nausea होगा. So बाकी सारी चीज़ों में भी तो होता है ना, अगर आप हार्ट की ये करते हैं या डायबिटीज़ है, आपको शुगर नहीं खानी होती है, तो तब भी तो आप ये सब करते ही हो ना. तो फिर कीमोथेरेपी से क्यों डरना?
एक्चुअली कीमो इज़ नॉट स्कैरी एट ऑल. ठीक है, हैं थोड़े साइड इफेक्ट्स हैं. जब आप कीमो ले रहे हो दैट टाइम यू डोंट फील एनीथिंग, इट्स जस्ट टेकिंग एन IV. बट कीमो के साइड इफेक्ट्स से चूंकि हमने इतना सब कुछ सुन रखा है उसके बारे में कि इट्स वेरी स्कैरी. But then the doctor told me that जो आपने कही सुनी बातें सुनी हैं, those are probably 20 years, 30-year-old things. So it's all कही सुनी. When you actually go through chemo, you will realize that it is. Some of my friends have had worse pregnancies. Okay, the chemo in itself. In fact, the first chemo when I did, I went and asked the doctor, "Okay, do you think it's working on me because I've not had major side effects?"
ये तकलीफ उतनी नहीं होती कि जिसकी वजह से जिसको आप झेल ना पाएं, जिसको आप बर्दाश्त ना कर पाएं और जिसका आपके शरीर पे एकदम लॉन्ग लास्टिंग या परमानेंट असर होगा. और ज़्यादातर पेशेंट समझ जाते हैं इस बात को और फिर ट्रीटमेंट कराते हैं.
Fear is a real emotion and side effects have to be dealt with too. It's important to keep reminding oneself that chemotherapy is a friend. It's fighting for you. And this pain is temporary.
Try to visualize the chemo molecules coming in contact with the malignancy, coming in contact with the area that it is supposed to attack, how it is affecting it, how it is sort of breaking it down. Visualize the tumor almost melting. उसको पिघलते देखते हैं, you know, you actually visualize it sort of melting or shrinking or some sort of reduction in the problem. So that acts on a very symbolic level as well, a very sort of suggestion-based level as well. And when that happens, there is a physiological response.
Ruby, a stage 3 breast cancer survivor, picked up her paintbrush during her chemotherapy. Painting helped her calm down, focus, cope with the side effects. She continued to work on her day of chemotherapy but would take a few days off after each session when the side effects showed up. She lost her hair as a result of chemotherapy and had nausea. But now that she's cured, all those side effects are a thing of the past.
In fact, now when I look back upon my experience, I really laugh on myself as to why my hair issue had become so important to me compared to my life. And yeah, finally what I also thought that my life is so important for my husband, for my children, and what I'm bothering about is my hair, which became a trivial issue actually later. So what I want to tell anybody who is going through the treatment is that these are extremely small things, number one, and number two, you look extremely pretty without hair also. That is what I realized.
One needs to make friends with chemotherapy and cope with it. This is the time when the body's immunity is low, and watching out for infection and maintaining nutrition is an important part. Ask your doctor for specific advice if any side effect is too extreme and take care.
कीमोथेरेपी कंप्लीट होने के लिए भी आपको कभी कभी हमें सप्लीमेंट्स की ज़रूरत भी पड़ती है, जो न्यूट्रिशनल सप्लीमेंट्स है उनकी ज़रूरत पड़ती है, क्योंकि आपका जो लिया हुआ जो नेचुरल फूड्स, नेचुरल वे से जो डाइट लिया हुआ है वो कम पड़ जाता है, क्योंकि आपको नौशिया होता है, आप ले नहीं पाते हो, वॉमिटिंग होता है, आप ले नहीं पाते हो। पर ये टाइम पे हम लोग आपको ब्लैंड और क्लियर लिक्विड्स लेने के लिए बोलते हैं, जैसे कि नारियल पानी हो गया, छाछ हो गया, दही हो गई, डिफरेंट काइंड्स ऑफ जूसेस हो गए हैं, खिचड़ी हो गया, जो चीजें जिसमें हम बिल्कुल मसाला भी नहीं यूज करेंगे पर फिर भी दैट थिंग इज एक्सेप्टेबल स्टिल।
Chemotherapy affects the entire system, bringing down immunity and increasing risk of infection. You need to look after yourself and take care. Remember, all this is temporary, and loss of hair is just a physical temporary phase.
कैंसर का ट्रीटमेंट जो है कोई इन्फेक्शन की तरह ही है। ट्रीटमेंट ले रहे हैं, जब तक ले रहे हैं तब तक प्रिकॉशंस लेने होते हैं, केयर लेना पड़ता है कि बाहर ज़्यादा खाए नहीं कीमोथेरेपी के टाइम पे, इन्फेक्शन का रिस्क रहता है। लेकिन एक बार ट्रीटमेंट कंप्लीट हो गया तो उनमें और किसी लेडी में जिनको कैंसर नहीं हुआ तो कोई फर्क नहीं है। कीमोथेरेपी के दौरान बाल गिर जाते हैं तो उनको पता चलता है कि नहीं कुछ ट्रीटमेंट चल रहा है, लेकिन ट्रीटमेंट कंप्लीट होने के 2 महीने के बाद जब बाल वापस आ जाते हैं तो मेरे हिसाब से तो कैंसर पेशेंट ज़्यादा सुंदर दिखते हैं।